Welcome to today's webinar, Harnessing Price Transparency for Providers and Provider-Sponsored Health Plans. This is Ashley Myers, HFMA's Client Services Specialist, and I will be moderating today's session. Now it is my pleasure to introduce today's speakers. John Squeo is the Senior Vice President and Market Head for Providers at CitiusTech with 30 years of experience in healthcare technology, interoperability, and cloud services. Previously, he's contributed to the transformation of value-based care initiatives at organizations such as Accenture and Tenet. Bryan Matsuura is an advisory board member at CitiusTech. With over 35 years of director experience in the healthcare industry, Bryan's expertise includes implementing complex enterprise systems, establishing digital solutions, developing new business operations, and leading operational process improvements at electronic data systems, Accenture, and Kaiser. And with that, I'll turn this over to John to get started.
Thank you so much. So the interesting topic. I'm very glad that you all joined today. We definitely want to make this interactive, so we'll be having a few polling questions throughout, just to kind of gather current sentiment and facts about the current state of price transparency in providers and payers. And we've actually have a guest who's with my counterpart on the payer side. So I'm really going to be talking more from the provider lens. Bryan will be really providing the payer lens. And we would love to also be kind of cultivating this idea that price transparency is really this capability now that we've been, that it really has been unlocked, that we can start to use for many different use cases. Probably we haven't thought of them all. And so this is just a work in process as these files become more available and more accurate. So I want to move on here and we'll just jump in. If we think about price transparency, we think about so many different angles. The first one really is how it benefits consumers. And then we think about how the key stakeholders who will go into can utilize this data as well. Now, in this talk, we're going to talk about price transparency in general, but we're really going to key in on really the value it can unlock for provider systems. So just to start off with, to establish the fact base, 28 million Americans exhausted their savings due to medical debt. 42% of millennials struggle with medical debt. So, you know, it's an issue, right? We all know that within our systems. We all are very conscious of the fact that the out-of-pocket burden is increasing to many of our patients and members. We have a plan as well. And, you know, the cost of treatment's continuing to go up. I think the thing that's the main theme is that we're starting to catch up with some of the regulations to some of the demand that people have been having for a long time, which is how much does my healthcare really cost out of my pocket? Of course, employers are very interested to understand why different providers that they send their employees to or their employees visit have such high cost variation. And they'd like to also take a little bit more control in being able to make sure that their contributions are sustainable for all of their employee base. And so as we think about this, this has really been driving this increased demand for price transparency for many, many years, just like we would expect when we buy airline tickets or any kind of retail item. But really, there's been no incentive for the key stakeholders, like, for instance, provider systems or even payers, to release that data. And in doing so, it created enough tension to where the government finally stepped in and said, we're going to require commercial plans to release the data, and also provider hospitals, as we all know. And we'll go into that. But I think the interesting thing here, as we think about the implications, certainly there's a certain percentage of the consumer population that is going to want to interact with this data. They're going to want to use it to try to do some planning, particularly for elective types of procedures. Certainly, probably not emergent procedures where you just need to get to the hospital. But the other component is really, as we think about how this data may be used in the future, we do think that it will lead to more of an efficient utilization of resources as hospitals have to start to conform to a more smoothed out or equilibrium on their pricing for certain contracted procedures. And that is really just going to be because payers are also going to be using this data as they negotiate participation agreements and contracts with the provider systems. So we do see a kind of a dispersion of this data driving a more reducing variation in pricing across the primary service areas and within contracts. And then ultimately, as I said, the main driver for this has really been the mandating of the price transparency for the two key stakeholders, providers and payers. And also, really, as the data is released, what we're discovering is that it's exceptionally cumbersome. It's non-standardized because really the formats weren't really defined exceptionally well. And basically the platforms themselves, sorry about that, the platforms themselves have not really matured to the level where the data is 100% reliable, but some of them are starting to mature quicker than others. So if we break it down, what we truly see is that as we think about the price transparency initiatives, there's a couple different sentiments that are out there in the market. One of the key sentiments of consumers particularly is a concern about surprise billing. And as we know, that has been a major focus as well of CMS and the ONC to ensure that that when a patient goes in to get a procedure, that if they've already gotten approval on a particular hospital system, that ideally the rest of the care provided by other providers that may be part of that procedure are essentially somewhat controlled and constrained and not going to result in a balanced bill. And this has been a major contributor to some of the medical debt. And now we're finally getting this addressed to a certain level. Now, we know this, right? There's been a huge transformation with surprise billing. And it's been, there's been winners and losers. But what we do see in these trends, and when we look at questions like, do you expect an initiative to lower costs, increase costs, or influence healthcare costs, it's kind of split. And so what's interesting here is that while people favor it, they're not too sure if it's going to really result in a favorable type of outcome. And so what we're seeing is kind of a mixed bag of support for price transparency, and yet it's here and the stakeholders are dealing with it. What we're seeing here is as the sentiment for support of price transparency continues to grow, we do see that and believe that this price transparency data will be better in its content, and basically it's here for a long, long time. It's not going to be rescinded, which means that all of us probably ought to learn how we're going to use it for our particular advantage, and also be aware of the implications that will result as the continued initiatives continue to be rolled out. As we get into it, we think about price transparency as in two different dimensions. The first one, of course, with the hospital price transparency, machine readable files, which are MRFs. And we know all of us had to do that in 2019. I think the really interesting things here is we had to publish the 300 shoppable services, of course, in 2021. And then really it's become more extensive of what we need to release in this year. Now, the benefit is a lot of this has been not too difficult to do for a number of health systems, because if they had, one particular EMR and they were somewhat standardized, it was fairly easy for them to comply and get the data released in a fairly reliable way. The other part of it really is how attentive we've been to ensuring that we've provided accuracy within that data. And, one of the ways to enforce that is really the penalties for noncompliance. We know that it hasn't been very extensive, the penalties themselves. And if we are, kind of asked about our conformance by CMS, that it's not really going to be that painful to a health system, although now they're starting to get much, much more attentive to nonconformance, and it has become a bit of a concern to a number of health systems that I speak to very frequently. On the other side, on the right hand, we have the payer price transparency machine readable files. Those are a little bit different, right? Because while it should be the same data, whether it's on the hospital price transparency or the payer published price transparency files, in fact, there are discrepancies, and we see them very frequently. And it makes people wonder why, if it's the same contract, that we see discrepancies between the two for the same payer contract, for the same hospital. Why should they be different? Well, one of the things that we're learning as we've analyzed this data extensively is that the payer data does seem to be more accurate in aggregate than what's being published by the hospital price transparency data files. A lot of speculation on why that might be, but I can tell you, and I'll ask my colleague in a second to comment, that really we think that because the payers files were published after, starting in 2022, there was just a lot more time to consider how to get them accurate. Also, while the penalties appear to be, reasonable, 162 per affected individual, if you don't conform, it's still a manageable amount. Yet, of course, if a payer gets it wrong, that they're a big target, right, for enforcement. And so they've been very deliberate. And I was a part of helping a number of very, very large payers when I was at Accenture develop these key systems and get the data out. And I think they were very deliberate and accurate in how they tried to do it. And so we're seeing that the payer price transparency data is a bit more reliable than what we're seeing in aggregate with the hospital transparency data. I want to stop. Bryan, do you have some comments on particularly how we did the price transparency data files and how we can rely on them, implications, et cetera?
John, why don't we maybe go to the implications, and we can really kind of talk about what were the impacts across the industry. And I think that will address some of it.
Yeah, we'll do it there. One of the polling questions that we decided to do here is, when did the price transparency rule go into effect? Kind of a fun question there.
So it looks like the results that we have for when it went into effect is that we've got 60% of the participants are looking at January 1st, 2021, 13 July 1st, 2022, 7% November 15th, 2022, and the remaining 21% November 15th, 2019. So, John, do you want to share the actual answer? And you're on mute, John.
Thanks. I mean, this is really the most common thing that we see is it depends on which one affected you, right? For instance, the hospital price transparency MRF files. Yeah, I mean, this was January 1st, 2021, which a lot of you chose. That was really the big day, right? Is from hospital perspective. So yes, I would definitely say that's the thing. But interestingly, for if some of your systems have plans, they're probably going to be thinking, oh, actually, it was July 1st, 2022 from their perspective. So this is the kind of differences that we're seeing, but very good for all. You guys pretty much got that right. So, as we go out and think about the different stakeholders that may take advantage and really utilize this data for the first time, we think about this unprecedented opportunity to really grab the data and possibly even munge it with other data to really create new insights that we have just never had access to before. A lot of the pricing has always been either reference data from kind of self-insured organizations that may have sold it, maybe some stuff that's been gleaned out of clearinghouses and then aggregated and completely anonymized to kind of give directional or indicative pricing information, but really it would never give you something targeted specific to an actual provider system or an actual facility by address or a doctor specifically by NPI. So as we think about it, when we think about the stakeholders, the payers obviously are organizations that want to see the data for expanding their network. They'd love to understand what other payers, competitive payers, are potentially paying for the same procedure or service line within a particular primary services area. And they're going to use that for, renegotiation to expand their network and other types of insights that they might want to derive. Of course, if they can munge that with different data, like utilization data, which is not in the MRF file yet, but if they can munge it into the same platform, now they can truly understand how to build a low-cost, high-quality network at a much more granular level than with some of the insights they had today. And then providers on the other side, obviously, it's incredibly important to you all to be able to access this data at price renegotiation, because what we're seeing is the payers are getting it, they're utilizing it, and they're going to have a much better insight on what you are getting paid by their competitor plans. And this is what I see as the bigger risk, but it's also an opportunity, because as they come in and as a plan is looking to add you to their network, you also know what they're paying your competition. And in these files, particularly the payer files, it shows what plan type it is. So you'll know if it's PPO, you'll know if it's whatever type of HMO. And so it tells the plan type. And so that's actually pretty helpful to determining plan by plan what your competitor hospitals are going to get paid for by those particular competitor plans, and then you can essentially set your price. So when we think about it too, TPAs and brokers have been trying to disintermediate payers' distribution channels for a long time, right? And this gives them potentially the ability to go in and kind of gamify what plans they will sell to what particular regions of a large employer. And so they have been interested in this capability as well. Obviously, researchers are interested in the data for policy evaluation, academic research, but patients and members, ultimately, this is what the government did it for. It's so that people can actually determine what they're going to pay for out of pocket. And then employers, of course, this is where they're trying to get the maximum amount of care, right? And so they're trying to really choose wisely the facilities that they're going to be including in their networks, particularly for self-pay and for self-insured. And then obviously the bigger concern that many have had is these watchdog organizations that are going to really examine high-priced procedures in certain areas and try to make a case out of it, right? And try to say, hey, this is inappropriate, etc. And ideally, enough if we're doing the right anomaly detection within these data sets on the right kind of platform, you're going to be essentially you're going to have your own insights created that, oh, this is a really, really high anomaly of how we price this particular procedure in this market. Now, you might want to continue that, but at least you'll be able to form a strategy around it if the watchdogs like press or other types of organizations try to expose that. And so these are some of the areas, but I just wanted to really stop. That was really my provider lens looking at this. But Bryan, from your perspective, former Kaiser, and really, clearly I know that you worked distinctly bringing the price transparency initiatives to live for a large organization. What are your thoughts?
Thanks, John. Let's take a step back. Initially, John was talking about in the first couple of slides, really about the financial burden that some people see as far as healthcare debt. And so let me start with the patients and the members and the impact across to them. And I think what I'd share is that the implications and the impact on each of the stakeholders differs depending on what your role is, right, in the healthcare continuum. And so if I really kind of think first about what we saw regarding surprise billing, there's a couple of solutions that came with price transparency that really helped the patients and the members. As John had mentioned, one was now members have access to an internet-based self-service tool, and this tool allows them to shop for services as well as compare the cost of those services across providers, right? This really enables the members to understand their financial responsibilities and make an informed decision prior to receiving care. John, I think we lost the presentation again. There's a couple of things in regards to that, right? You have those who are making decisions based on an elective service, and that you have those that are forced to make a decision because they've got to perform the procedure in order to impact their health. So, but the bottom line is what we've seen and what I've seen as we released this tool, because I wasn't sure, quite frankly, whether or not the members and patients were going to use the tool, but I was gravely wrong. We had access to this tool before, right? And I think really the hit rate was something about 400,000 hits per month. I may be wrong with on the intervals, but the utilization for looking at the pricing for any given service has gone up like 200%. As we look at the TPAs, the brokers, and the employers, and I want to kind of consolidate those three. Remember, what has happened with price transparency is you now have access to all the hospital procedures and the rates associated with those procedures. Got pricing information that includes fee services, right, and contract rates. Provider contract rates are all now disclosed. And depending on where you're at, right, as John had mentioned, from a provider perspective, I can now look at not only my rates, but I now have access to my competitors' rates. And what that will allow me to do is to figure out whether or not I'm being fairly paid. From TPAs, brokers, and employers around the fee schedules and the contract rates, they've made it clear that they want to analyze that data so that they can also ensure that their premium rates are being are at a level that's fair. So they want to come back during renegotiation and use those for renegotiation and renewals. So, John? Oh, so we have our next polling question.
Yes, we do. who are the stakeholders for hospital price transparency?
And your options are provider, payer, members and TPAs, brokers, or all of the above. So take a few minutes to make your selection.
All of the above, absolutely. Good job, everybody. And all of the above and even more, right? So who knows how much this will be used? It really is, the sky's the limit. You know, as we think about having the public access to this data and what it can unlock, we've thrown out some ideas. I am sure that this list, 5 years from now is going to look remarkably different or maybe more expanded. And we'll probably have a much better idea about the implications that this is truly going to have to physician practices and where they're located and where a clinic's located. Is a clinic even going to be a clinic, or did we find out through maybe pricing data and informed through that and other data forms that we should have a different location of care or site of care? So who knows? But what we do believe today is that with payers, they're going to use it for renegotiating contracts. They're going to use it for pricing insights as they think to expand their network. They're going to, ideally, they're going to be able to push down some of the rates that they're getting, that essentially they're having to pay for high cost procedures. At least that's, I think, the stated goal that I hear from payers as they invest in these type of platforms. Of course, this idea of network optimization as they continue to expand their network or just try to enrich their network with the right amount of adequate specialists and facilities. This gives them a little bit better insight on making the choices of who they do have enter their wide networks or narrow networks or even in micro networks. And then with outcomes, I mean, ultimately we hope that the member wins, and this ultimately will result in lower premiums and lower out of pocket. That is unseen. We don't know if that'll happen, but that clearly is the primary reason that this was essentially affected by the government. And then with providers, you guys could certainly tell us better how you might use this. But what we do hear from a lot of the provider systems that we frequently consult to, that we frequently transact with, the contracts with competitive pricing, value-based outcome-based contracts, this is all going to inform that to an extensive amount, right? And then really on network optimization, being able to truly participate in low-cost, high-quality networks ultimately is the goal. The cost ideally will be revealed by this. The quality will be revealed by quality and utilization data. The ultimate nirvana is to be able to munge that data into a common platform. When you guys are thinking about looking at these kind of platforms, that would be a recommendation, is to get one that's flexible enough to include the pricing data that's raw out of these MRF files, machine readable files, but also to be able to bring in some of the quality data that you're getting from your macro and mixed data, and also your internal quality operations data. And then, of course, ultimately, there's another data source out there to give you a little bit of external ideas on which providers are doing what services where. And that's, of course, the Medicare claims data that we could potentially bring into a common platform so that you would know who your competitors are in particular PSAs. And then you could look at the rates via the MRF. So the ideal here is for providers, if they get the right platform incorporating this, it'll give tremendous insights into really driving high quality, low cost care to really optimize your value-based contracts. And ultimately, we hope that patients will win by prices coming down competitively. Obviously, employers, very same type of implications. If you think of that in the light of this will give them additional insights to determine where those high quality, low cost networks are. And really, ultimately, if they can get the total contribution that they're giving to the increasing costs of the plans, if they can really get that capped and under control, we can slow the encroaching burden that really is on the employee or the consumer themselves as far as the amount of out-of-pocket that they have to spend, which is going to make happier employees ultimately, and it'll also make them feel a little bit richer because less of their total compensation package will be consumed by the increasing cost of healthcare. Bryan, what's your thoughts on how this truly is going to play out as we look ahead?
I think that's the way that I respond to that is this is a start, right? It's not perfect. You mentioned earlier, and I saw some comments that were spot on as well, but you had mentioned earlier. I mean, there's a ton of data out there. The part of the access to the data and the interpretation of the data is challenging, partly because of the complexity of the data within healthcare, and partly because the structure of the data, a common standard structure for the data, was not built into the regulations, right? So it's indeed helpful to get a partner to access, right, your competitors' data so that you're measuring apples to apples. So the other thing I just really want to add on to what you've already shared is I don't think this is not a one and done, right? Today we have the hospital data, we've got pricing information, we've got contract rates. And, it's what the CMS and HHS is looking at next is really to reintroduce, if you will, the prescription drug data. So I do think that there is incredible possibilities and probabilities, right, to look at your competitors' data, to compare and to contrast, right? To look at the highs, look at the lows, look at the highest volume, look at the lowest, maybe throw out the lowest volume, and use real data, right, in the future, really to kind of adjust kind of your rates and right, and your own information while ensuring, right, that you still maintain a fair profit.
Hey, we'll move on, and I'm dying to get to the Q&A section of this, but we'll ask a polling question. How can hospital CFOs effectively communicate the financial benefits of price transparency to both internal and external stakeholders?
So do you avoid communication about pricing? You provide clear and understandable information about cost savings and improved revenue? Do you do so by limiting stakeholder access to financial details, or prioritize complexity in financial discussions?
This is super interesting. So it looks like there was a convergence by providing clear and understandable information, which that is super exciting, and I think completely in alignment with what the government intended this to be. So I mean, I think that really is within the line of what the goals are, and ideally, I think this will result in a much improved and informed population of consumers. So really, I mean, just to kind of put a cap on where we're at, as we think about the health systems and the health plans, and really where you're positioned to try to use these insights, you have to have the ability to convert this raw data into actual analytics that make sense, that provide the specific data that you actually need, but not just in data form, really creating just information that's digestible and usable to create knowledge. If you look at the data itself, really you have provider NPI at a very arcane level. If you just actually guys downloaded this stuff, it's almost unreadable. When you do that, you also have to have, they'll give you the plan ID, but you have to resolve that to what kind of a plan is it. You might get the provider NPI in there, but you won't have the address, you won't have the doctor's name. So the best platforms out there are ones that go and grab this information from many different sources beyond just the MRFs and bring it all together in one place. They identify the ICD and the CPT codes, and they identify those by specialty. And that's the kind of information that you need to enrich what comes raw in this price transparency public data. So the platforms out there, there's some great ones. Obviously, we have one too that really provides that information kind of in a one-stop shop, single screen, so where you can start really peeling the layers of the analytics. And what you're going to get on most of them today is just the foundational, the pricing analytics that are coming from the actual real contracted rates that are having to be released. You also, I would recommend, get a platform that can start to incorporate, as I talked about before, the measures that you're taking from MIPS and MACRA, and also your operational measures to really start to drive the quality with the pricing. And ultimately, then, you want to have a platform, if you really, really want to get the benefits, that will give you some predictive analytics, the ability to also bring some artificial intelligence in there, but it's going to create a model that you could use for scenario planning. Like, what if we contracted with this? What are the implications that we would see downstream to possibly the rest of our payer mix, or other providers within the network, and et cetera, et cetera. And also think about if you're expanding into other regions, understanding what the pricing is out there of certain specialties, certain different types of allied health professionals that may be out there, certain types of clinics. This is what's going to give you that additional insight. And as we use predictive analytics on top of that, you'll be able to create those kind of simulated scenarios to really understand the implications it will have for your system. Bryan?
Yep. No, I think you're absolutely right. I think this is really going to be a journey, and this is a process, right? We're at the beginning of this, and it will take us a while to analyze what we have and align with HHS and CMS to figure out, right, as they move forward with the next set of the transparency and pricing regulations.
All right, polling question 4. How does provider price transparency contribute to value-based care? By discouraging collaboration with payers? By focusing solely on volume of services? By emphasizing outcomes over volume? By limiting access to quality healthcare? Let's try to figure out your best answer you might have to this. Yeah, this one is so interpretive, right? I mean, the answer, I think, at least my answer when I saw this originally was like, I don't know. Emphasizing outcomes over volume, I think, really is where we're trying to get with that value-based care as this hopefully drives, the consumer choice or employer choice, and starts to really get the pricing variation to conform to more of a median price. And ideally, that's going to get you better financial outcomes, coupled with, obviously, if it's more affordable, ideally people will be able to access more care and be able to stay well longer, which ultimately may lead to an overall, improved wellness for a particular member and patient, which ultimately I think will help the entire economics of the healthcare model. So as we go through, I mean, just the very last here, as we think about data preparation and validation and provider mapping and data maintenance lifecycle and this, idea of geographic coverage, I'm not going to bore you with it. I think what's really key here is that it's hard to do. Only the best platforms out there are really getting this right. But because doing it yourself would be really, really difficult with the kind of complexity in the data that Bryan had mentioned earlier. So I think the way to go about trying to capture this and really start to unlock the value from the data that's new and out there is to get identify a particular platform that brings us all together in one place. It's and provides those canned analytics that you could tailor on your own. You could bring your own data into, typically the really good systems integrators will just do that for you in their platform. They can bring in choice pieces of information and start to really get some great analytics that you can make some great decision support for your contractual engagements with your payers, and start to really also analyze your participation agreements and contracts even mid-year of is it doing are prices changing out there, or are contracts that you have with one provider or one facility with the same exact plan, with the same exact payer, is there variation there? All these types of questions that we typically never thought to ask before because the data was just too hard to get to. The data's there now, and with the right platform, it makes sense of that really automatically for you once that gets set up. So I'd love to move on to Q&A now, so I'll pass it over to our session moderator.
Yes, thank you, John and Bryan, for that engaging presentation. I would like to remind the audience listening to enter your questions in the Q&A box located at the bottom of your computer screens. All right, first question. Have studies shown that price transparency has shown an improvement in proving patient financial expectations?
Wow. That's a tough one. There's differing studies out there, but they are fairly, there's not that many because it's fairly new phenomenon. What most of it's based on that we've seen was the CMS release of the Medicare pricing data through the claims data, which was a trend that happened about 10 years ago. So based on that, there is some interesting effects, and there's a couple cases out there where the shoppables, shoppable procedures like electives are being much better researched by members as they go in to get those procedures. So, but with the data that's being released from the hospital data and the payer data, I have not seen that many studies yet of the results and causality of it. So I think it's open for debate. Bryan, any thoughts on that?
No, I agree. It's this is pretty much a new regulation that has gone in the last couple year or two, and I've not seen any outcomes or any study yet. The only anecdotal study, right, that I can share is based on the one data point that I talked about, really with one plan that just really showed how much interest there is, not necessarily a study showing that it contained the costs.
Great, thank you. Next question. Is there an expectation for physician providers to be included in price transparency soon?
Yes, so there already are, right? Hospitals are releasing their data, but Bryan, go ahead.
Well, that I was going to also ask for more clarification, but there are, from a provider perspective, there is a requirement that's already been enacted that has the provider contracts and the provider rates. There's not necessarily any quality, data points that are associated with that public data.
I would say also, if, like, for instance, hospital data, obviously outpatient clinics, we in the data itself, right, we are seeing professional fees, right, particularly in the payer data. So the payers are releasing the data on the professional fees for providers. Frankly, it's also the ambulatory, right, because it's really any providers that have a participation agreement with the payers. As far as hospitals having to release the ambulatory clinic data, I'm not sure about that.
Yeah, but depending on really where that question was going, there hasn't been any regulations, or none that I've seen coming up, that says that the providers are going to have to provide any additional data, or do any or have any additional regulations that are provider specific.
Great, thank you. Next question. The descriptions of this work have been couched in helping the patient. However, the majority of the benefit is in contract strategy and reimbursement. This seems misaligned. How do we make this more patient-focused? The cost of implementation was high, but maintenance is high for providers, all for the benefit of the payers.
Yeah, so I was with you till the last statement. Look, I don't know how much is going to benefit the payers. It will, to a certain extent. I'll agree with you. Let's see if it can benefit the patients themselves. Potentially, it could, right? If once you empower the patient to be able to examine the pricing for electives, and the patient can just simply choose to go to a lower cost facility, or based on the data, that in and of itself should result in a lower out-of-pocket burden for them. So that is a benefit, I think. As far as it being cost prohibitive for, and expensive, right, for providers and payers to comply, it's expensive for both of them to comply. It's been a big lift as far as cost to not only implement this, but to sustain it and sustain the increased accuracy that CMS is requiring. That's true. The other piece of it is only helping payers. I guess my thinking about that is that it's going, if the provider system is using this as a way to evaluate or detect if the payer that they're dealing with is paying their competitors higher, they should be able to use that to negotiate a better rate. But in overall power of negotiation, it might go a little bit more towards the payer side. I might agree with that. But Bryan, what are your thoughts?
I think one of the things that we have to remember is this is really a first step, right? And the focus, at least coming from CMS, right, has been that it's really, there's a focus on the member or the patient, and there's a focus on trying to contain the costs. And I think that this is my personal opinion. And so this is why, when we talk about all those data stores there, you've got the hospital data, you got the fee schedules and the contract rates, right? You got the contract rates for the providers. And then, eventually coming up, depending on how strong they lobby, right, we'll start to get prescription medication costs there that include discounts and rebates and chargebacks. And I think that dynamic there kind of goes back, and there's benefit to I think everybody within the chain of healthcare. Even though today it may be more perceived that this first release is beneficial to the payer or the plans.
Great, thank you. Next question. Without patients having a detailed knowledge of how healthcare claims are coded and finalized, how are patients able to even interpret this complex data?
No, that's a great question, right? So there are requirements for shoppable websites essentially as a, that you can click on from your payer plan to be able to identify a procedure and the cost of it potentially in an average, maybe by facility or by hospital, right? So you can kind of make a decision on which one might be more expensive, which one might be less, less expensive, to really try to make an informed decision about where to get an elective done. Now, we do not see an immediate future where a patient's going to be able to have a simple app or widget on their iPhone to really drill down and get, what a procedure is going to be for dollars, by dollars and cents at that level of granularity. But we think indicatively or directionally, it will, the interfaces that are available right now on payer sites as far as shopping, and it will be regulated to go on every payer sites, but some of them have already voluntarily put them up there. It is benefiting patients to be able to go and find a location that's going to result in a lower out-of-pocket burden for them. Bryan, any thoughts?
The only thing I'd add is just to kind of remember the shoppable services right now is a member can go out there and can look at a procedure that they may want to get done, and they can shop that by provider, right? And they can see what their financial responsibility is. I suspect that as the regulation evolves and matures, that hopefully that will become more and more robust. But I think that that's part of the challenge with healthcare today, right? Is for the members or the patients don't always understand what they're getting billed for or why. And I think one of the other things I didn't include is along with those shoppable services. So once I look up those shoppable services, you also have the opportunity, right, to look or receive online an advanced explanation of benefits. And I hate to say that, which hopefully that will help, but I think in reality, what we've all seen is that sometimes an EOB, right, can also confuse a patient. So I think that this is really part of disclosing as much data and information as we can, so that more and more patients and members can become educated, and that's gonna be a journey.
Great, thank you. And we are approaching the end of the hour, so do either of you have any closing remarks?
Yeah, I would just say if this is something that interests you, there's fantastic platforms out there. Like I said, we have one that does this, very flexible to incorporate your data. There's other types of levers that a lot of hospital administrators I know that I talk to very frequently are looking for, and that is analytics for supply chain, analytics for all kinds of cost inflation to really reduce that. And so, we're always happy to talk about that, but we're really appreciative of your viewing of this and your interest in how you can learn more about price transparency and how you can use it to benefit your health system. And we're always willing to engage and tell you more.
Yeah, thanks to all for all your patience and allowing us to share this with you.
Yes, thank you. And with that, we have reached the conclusion of today's webinar. I would like to again thank our speakers for presenting and CitiusTech for sponsoring. We hope you found the presentation informative, and we appreciate your patience with some of the technical difficulties that were had. Thank you for your participation and have a great day.